Hello, and thank you for listening to this online presentation titled A Considered Approach to Preparing for Student Placements, which is an Australian University collaboration between myself, Suzanne McGavin from Rmit University, Kim Barry from Charles Sturt University, Melissa Shields from University of Newcastle, and Catherine Guerrero from University of South Australia. The aim of the presentation is to support a considered approach to placements with the input and collaboration of all Australian university education providers. By understanding the expectations and working in partnership with the education providers, students and clinical sites, positive relationships and experiences can be cultivated during student placements. Taking a considered approach to preparing for placements will aim to maximise learning opportunities and improved outcomes for the student and site. The presentation will cover the expectations from the university, student and clinical site. A brief toolkit will be presented to help support and prepare sites for placement, and then some work scenarios will be demonstrated with the aims to assist sites for these situations. As the presentation has been modified for a recording, if you have any questions or troublesome scenarios, please feel free to contact any of the university academics. All details are at the end of this presentation. It is important to understand the expectations of all partners in clinical placement, as this results in increased fluidity of the placement experience and a better learning experience for all partners. What should be expected from the university is that they provide both the theoretical and simulated practical experiences of nuclear medicine. This is conducted through a combination of lectures, tutorials, practicals, and worked examples with a supporting clinical placement. The assessments are pedagogically structured and scaffolded to support learning throughout the program. What this means is that the assessments are not standalone, but built into a larger approach to learning nuclear medicine, scaffolded over the years and skill levels. Students are explained the rationale behind each assessment and how it is to consolidate and demonstrate their learning. If any site has any questions about the assessments, we encourage you to talk to the university to understand the learning outcomes intended from that particular assessment. Each university holds a live or face-to-face tutorial to prepare students for placement. This outlines all paperwork, expectations, skills, and outcomes required for the placements. Students are given their clinical work prior to these sessions to allow them to be prepared with questions in relation to the university tasks. Attendance at these sessions is highly encouraged as it is where all information is outlined to the students and questions can be answered and clarified to students. They will then feel prepared and ready for their clinical placement. Additionally, each university has an academic assigned to the student placements, so students and sites always have a point of contact for questions, clarifications, or assistance surrounding placements. When students undertake a university program, they are expected to be an active participant in their learning and to seek knowledge, demonstrate skills, and work with others to improve understanding. The expectation of a student include the completion of all theoretical content and exercises delivered at university before placement. All students are expected to attend or listen to all lecture content, tutorials, and practicals. This structured content throughout the semester allows understanding and the ability for concerns to be raised during or around these topic areas. Students are expected to complete all assessments and paperwork to support their practical and theoretical learning and apply this theory to practice. They are to understand the expectations of the university before attending their placement and understand the expectations of the clinical site during their placement. Students are encouraged and expected to be prepared to engage in the clinical environment and participate in patient care in nuclear medicine. The expectation of the clinical sites that support students include designating a staff member who is engaged and supportive of student learning. The clinical site should provide the practical experience and clinical opportunities for students which meet the year and skill level of their program. This means that a first year and a fourth year student may have different exposure, and they should be rostered as best they can to facilitate this. If you are unsure of what the student's skill level is, please refer or ask for a copy of the combined clinical student requirements the universities have created and update regularly. It is expected that clinical sites engage with the universities to understand each of the requirements of the students they take. This may be in the form of industry meetings, emails, or phone calls with the university. At any time, if you're unsure or need clarification, each university is happy to clarify the requirements with you. It is expected that the clinical site raises concerns about students early. This gives the university the opportunity to engage and offer support in a variety of different forms. It also allows the student the opportunity to develop and ideally overcome these concerns to progress during their placement. The university is here to support clinical sites. If the student is not meeting your expectations on any level, please feel free to contact us. It is expected that the clinical site does create an inclusive environment for all students. It is important the student feels like part of the team and they can contribute to the workload. If there are instances in which it's not reasonable for the student to be included, let the student know and offer them alternative tasks to complete. Lastly, it is expected that a professional example of nuclear medicine is demonstrated in front of the student. Through promoting positive workplace practices, the students are more likely to look to their supervisors and other technologists as role models and mimic their behaviour. Don't forget that the students of today may be your colleagues of the future. The clinical site, university, and students all have a role to play to create an optimal clinical placement. Clinical placements don't work unless all three parties understand the expectations and can work harmoniously to support one another and meet these prospects. If you have any questions, please reach out to the university so that we can assist you. Next is a summation of a basic toolkit which can help sites and students prepare for placement. Another collaboration, which has also recently been published, is an article by the universities, which is there to support with some key principles on supervision so that all nuclear medicine technologists can be supervisor ready. It's a good read, trust me. Orientation. The unknown causes more stress than we can think for our students. Placement is already a large and intimidating unknown, so having some key documents or elements for our students before they arrive can really help relieve some of the first day placement anxiety. Information which could be included in an orientation pack or booklet, no matter how big or small your site is how to get to your site by different modes of public transport, including what station to disembark, and then the instructions on how to get from there to the front door of your site. Some students may drive, so how much is parking? Is there any free parking? How far away is it? Can they get a staff parking card while they're on placement? The location of your department may be important, especially if it's in a hospital, because we all know most of our departments are in the dungeons of the hospital. So maybe some brief instructions, including pass the cafe on the left and take the blue lifts on the right. The components of your department, including the number of cameras, the vendors, and the standard mix of studies. This will help students know if it would be a different system than they've used on a previous placement, and also potentially brush up on some theory if they're not confident in the areas that are your main studies. Again, this alleviates the unknown and anxieties that the students may have. The organisational structure may be helpful for the student to know who to go to and for what. Importantly, who to go to if the student supervisor is away. All departments should have a 2IC for students. Maybe also include how many staff are in the department so they know if they're walking into a large or smaller department. Possible working hours and if they're different for each section, PET, general nuclear medicine, hot lab. This may help the student to navigate their public transport options or possible their accommodation options. The expectations of your department, things like using a mobile phone, What is the break schedules? What's your policy on hair? This resource could be repurposed from the university clinical handbooks that you should all have, and if you don't, please contact us. The students may actually read your version, so feel free to use our words. You may also like to include a potential roster if possible and put in there that you know this may change when a student starts. This could assist the student by preparing and organising this assessment. Something basic such as third year students will be rotated through PET and Hot Lab. First year students will be staying on a dual headed camera for the first week, or something very basic like that. Pre-planning for a student arrival can ease some of the clinical pressures on the site and when the student actually arrives on the day. Ideas to action before a student arrives include understanding the particulars of the university for that placement. Know what the student's theory knowledge should be, their assessments, and all this can be found in the National Student Clinical Requirements document that we have prepared. Let the entire department know about the student and what they can expect. This includes administration staff. Include their name, their year level, so that on the first day, the student feels welcomed from the moment they present to the desk. Ensure a staff member is allocated to the student on that first day. We understand the designated student supervisor may be busy, but allocate someone so the student is again welcomed into the department. You may find it easier to have a delayed start for the first day, after that morning rush. Also have a backup if the designated staff member is away that day. Have some ideas if the student will be staying on a particular camera or following a staff member, and communicate this to both staff and the student. We recommend for early years that staying on a camera is more beneficial for student learning, and then once a basic workflow and understanding of nuclear medicine is there, in the later years, following a staff member as they move to various tasks may be beneficial. Create a draft roster with the information you already have, so bookings may be altered if needed early. We all know, especially on that first day, the camera will run slower. Prepare for this to reduce your stress in the department. Students should have contacted the department no later than a week before starting. If they have not, please contact the university for us to follow up. Sometimes they may have the incorrect contact details. When the student does make contact, ask what assessments they intend to complete or have previously completed. This may help with the draft roster you can put together. I think we all know that a little bit of planning or organising before an event helps reduce stress and anxiety for all parties involved. This will also create a more fluid and positive clinical placement. Objective setting. We know that in the profession that everyone does things a little bit different. Students, though, do not really know this and make assumptions that what is okay in one department will be okay in another department. Sometimes this can create an unintentional stressful situation for the student and the site. So things to think about to discuss with a student include understanding their assessments and what exposure is necessary to facilitate these, and what does it look like for them to achieve it in your department. Outline the roster so the student has a clear understanding and can prepare for each day and week. Discuss their previous experience and exposure so you can discuss what you will expect in your department. Understand the paperwork required and let the student know when it is expected to give this to the supervisor. We recommend a Wednesday to allow time for staff to complete this, and also have a discussion with the student so that there's no surprises. Let the student know how feedback will be given, daily, weekly, or just at mid-placement. Have a clear objective of what the goal and skill level is expected from the student by the mid and end of placement. And what would the journey to this goal look like from the department's view? Do you expect them to run the camera independently? Do you expect them to only complete patient interaction or also processing? Outlining these and having this discussion allows the student to be prepared and not surprised with aspects during placement. It creates transparency and a solid foundation with objectives for the student and the site relationship. I think we're all on the same page when we say COVID-19 has affected the development and opportunity to develop the soft skills for our undergraduate students. What was previously expressed in multiple aspects of face-to-face learning now has a heavier emphasis for development on clinical placement. Students will come from a variety of backgrounds, and it is important that we understand our student diversity and aim to improve students' soft skills from their initial starting level. Ideas to foster these soft skills is to gauge the level on the first few days, and if there is potential concern, talk to the student privately and discuss these observations and what you have expected. You may learn that they are timid, overwhelmed, or anxious. These all may be exhibited the same, but could have different solutions. Be prepared with ideas to help the student. They do see you as experts. After this, potentially partner the student with a different staff member who can support the student to develop these skills. Possibly break tasks up and allow the student to develop towards the entire task in a reasonable time frame. Most of our students really want to do this profession, but have not been in a patient-facing environment. Let's help them develop these soft skills. Feedback is the cornerstone of student development and learning. Everyone gives feedback in different ways and for different reasons, and truly could be a topic on its own. So very quickly, it is important that the student understands how your site will give feedback and when, as we discussed previously. The formal feedback process for all universities is the supervisor report. There is normally one midway through and then one at the end. This gives a structure to the feedback mechanism. The report tool is intended to make the process easier for the site and also gives the students a performance guide mid-placement and at completion of placement. It allows for easy recognition of student strengths and development areas and is an objective measure to the clinical grade attainment. Of course, feedback will happen informally as well throughout the clinical placement, and if given constructively, it offers opportunity for student growth. Our discussion with students revealed it's common students are apprehensive about tasks when they get in trouble for doing it another way that a nuclear medicine tech has shown them previously. They lose confidence and all of a sudden can't perform for fear of their repercussions. We all know that we all do the same job, sometimes quite differently, even in the same department. Navigate a way of talking to the student about why you may do it differently, but that they are not necessarily wrong, it's just different. Be very careful with your wording. Be careful not to give feedback when stressed or under time pressures. It traditionally is not received how it may have been intended. Park the idea and come back to it when things are a little bit less stressful. If there are large pressures, talk to the student and explain that due to this situation, would it be okay if we worked more as a team and I will do this part of the job if you can move and do this part of the job and then we can complete these tasks more efficiently. Students just want to be part of something. Navigate a way to let this happen organically. Next up are some scenarios which students or placements may come across if they're unprepared and what actions may assist in these situations. First scenario, a student doesn't know what they are to do on placement. All students will have a placement document outlining their objectives for the upcoming placement. They will also have had a pre-clinical briefing prior to placement. So, refer these students to the university documents or supervisor. Next, if a student lacks relevant theoretical or practical information, so as a site, you can refer to the student clinical requirements handbook to understand what assumed knowledge the student should have. So all students have access to textbooks and lecture material. So if the topic hasn't been taught, get the student to do some reading as well as go through the basics with them. If it has been taught, refer them back to their books. Next is if a student has had personal issues going on in the background. At times, none of us know what is going on personally with a student. They could have had a relationship or family issue, have physical, mental health, or financial issues. Any one of these could impact their ability to prepare well for placement. It also may be difficult to determine that there is a problem. Contact the university and they can refer the student to the appropriate university support services and have a chat with them away from placement. Next is socially awkward students and those with low confidence levels. And these are ones that might take a couple of weeks to become more comfortable within themselves and then within the department. And after this, they will then start to show their true ability, hopefully before that mid-placement progress report. By helping these students prepare for placement prior to their placement commencing and giving them structure within their placement from day one, it will decrease their anxiety levels and improve the overall learning experience. Allow the students time to observe the workings of the department before expecting them to perform at a suitable level. Also try to understand departmental relationships, like where everyone does fit in and where this will be where they fit in. This will take some students longer than others, especially those with low self-esteem or low confidence. Some scenarios for an unprepared clinical site. So the supervisor is unaware of what is expected of the student prior to placement. So each university should send out the placement objectives prior to the placement commencing. They would send out the student's name and also the clinical handbook. If a supervisor has not received this, there may be a chance that the university has incomplete or outdated details. Please contact the university and ensure that we have the correct details in our system, and we will send the information immediately. Another scenario is that the students haven't been given any pre-placement information when they have contacted the university. This is what we were talking about before, about possibly providing an orientation document, and giving the student the information prior to them arriving means that they're mentally in a better state and prepared to start the work week. It also allows for a smoother transition for them and for your department. There may be a situation in that the clinical site is unaware of a student arriving. This may mean that the student supervisor knows there is a student but has not communicated this to the rest of the department. As we said before, ensuring that you can communicate to your whole department right from the front desk to the back, it makes the student feel welcomed. Not doing this means the student will feel unwelcomed and sets a scene for their placement. Something as simple as the reception staff being aware of the student's start date and therefore greeting them when they walk through the department makes a big difference to the student and makes them feel welcome and supported. All four of us know how hard it can be to be constantly with students in the department, especially when it's busy and there's not enough staff. So we know that sometimes there's staff shortages, lack of resources or support. However, to the student, it can seem like the clinical site is not prepared, but in reality, the staff have been so busy or haven't been supported that they can't adequately prepare for the student. Be open and transparent with the student. Explain this and the student will hopefully understand, and you can both work together to prepare for the placement as it moves along. The following is a university support material we have available. Please contact the academic on the following slide if you do not have these documents. We have put a combined clinical placement calendar with all four universities. This may help you organise students for the whole year when you can accept them and when you may not be able to. Each university will have a specific clinical handbook for their university, which will have all the information. As said before, you may find some useful information here to put into your own orientation document. We have also worked together to have a National University Clinical Requirements cheat sheet, so to say. This is a very clear document that can tell you what the students know and what they're learning at each point during their program. Please contact us if you don't have any of this material. Here are the university contacts for each university. As I'm currently on maternity leave, I will direct you to our program manager for any further information, unless you want to discuss this particular presentation. Our other contacts, Kim, Melissa, and Kathy, are all here to support you. This bibliography has some fantastic references if you're interested in reading further about placements. In summation, there are little things everyone can do to alleviate anxiety and stresses for both the clinical site and student. All universities have a variety of support material and information. Reaching out and asking for support or assistance will create a positive approach to student placements. Thank you for your time, and we all look forward to interacting with you for our next student placements. Thank you.